Welcome to Better Than Ever Live, wherever you're watching or wherever you're listening. I hope you're making today your masterpiece. On today's show, we're going to talk about a very popular peptide called BPC 157. I'll explain what it is and how it might work. And then I'm going to share a study looking at its use injected into the knees of patients with knee pain to talk about whether it might be a good treatment for arthritis and other types of knee pain. I'm Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, anti-aging and regenerative medicine expert, and media medical expert. I'll help you feel and perform your best regardless of age, injury, or medical history. Please understand, in this live show and really any video I do, website, anywhere else, I am not giving you medical advice. This is meant for general information and educational purposes only, especially when it comes to BPC. This is not an FDA approved treatment. I'm not telling you to take it. I am just sharing information because I know a lot of people are asking about it. If you have comments or questions about BPC and injecting it into the knee and arthritis, leave those in the chat. If you're on YouTube, remember I'm not on YouTube. That's how I use Restream to send it. YouTube, LinkedIn, Facebook. Facebook and LinkedIn, comment as you always do, but in YouTube, leave it in the chat, not in the comments. I can't see that. I would also, whatever platform you're on, I'd love for you to share your first name and where you're located. I get people from all over the world on this show and on Ask Dr. Geier Live, so definitely share that along with your comment or question. And if you have an orthopedic question, an injury question about surgery or rehab or recovery, I don't do that on this show, but I do it on Fridays, 12 p.m. Eastern Time for Ask Dr. Geier Live. So make sure you join us there. I'll say a little bit more about that at the very end. But let's get into what I think is a very, very interesting topic, and that is this peptide called BPC 157. I've talked about peptides a fair amount before in terms of what they are. They're chains of amino acids, really short proteins is probably an easier way to describe it, that are naturally made in our body. There are about 7,000 that are made in our body that have been identified. And they all have different functions. Some are good for your brain, some are good for your heart, some are good for weight loss, immune function, sexual function, skin, hair, and there's some thought to be good for orthopedic reasons, muscle, tendon, ligament, possibly bone and cartilage. And BPC 157 is one of those. BPC, if you're wondering, stands for body protection compound or body protective compound. This is a peptide that has been used for many, many years, sort of under the radar. Athletes, bodybuilders, powerlifters that have injured muscles, injured tendons, ligaments, and joints. If you go and do a Google search for BPC and end up go into like the Mayo Clinic sites and things like that, but some of the message boards, you'll be on like bodybuilding message boards, powerlifting message boards, and you're going to see this along with maybe thymosin beta 4 and CJC 1295. And you're going to hear about all these athletes, all these bodybuilders and weightlifters that had this injury or that injury and nothing was getting them better. Maybe somebody had surgery and then somebody suggested one of these peptides or multiple peptides, and all of a sudden they have no pain, they can lift better than ever. Again, as I said in the open, BPC is not FDA approved. It's thought to potentially be a regenerative peptide, hence the musculoskeletal portion. It has been shown in animal studies to increase the production of type 1 collagen. If you remember from biology class, type 1 collagen is what makes tendons, ligaments, and muscles, so in theory, it should help those heal. And BPC has been thought to reduce inflammation. Now, there was a really, really interesting Croatian study, Dr. Sakiric, way back in 2005, injected, and I want to say it was in rats, but injected BPC into the abdomens of rats after detaching their Achilles tendons. And just by the BPC being in their abdomens, it caused that Achilles tendon to heal down to bone. So that led to a lot of people saying, hey, BPC may help heal a ruptured tendon. And that's probably where all these athletes, all these bodybuilders, powerlifters have been going to say, hey, I'm going to get BPC for my injury. Now, to be fair, they're mostly not getting it from physicians. They're going on the internet where it's widely available to purchase. Very, very questionable how safe that actually is, but I know very well that that's been happening. Now, there has not been a study of BPC 157 use in humans that's been published to my knowledge, except for the one that we're about to talk about. And again, it's not approved by the FDA. It's possible the FDA may actually restrict the use of BPC 157 going forward, and that's why there aren't that many compounding, FDA-approved compounding pharmacies that actually make BPC 157. Now, this is a peptide naturally made in our gastric juices and in our stomach lining. And again, most of the studies are either lab studies or they're animal studies. But in those studies, it does look like it speeds up the healing of wounds, of different injured tissues like tendons, ligaments, bone, muscle, skin, and even the lining of your stomach. It is a healing peptide, and it's thought to, at the microscopic level, promote regeneration, tissue granulation, fibroblast recruitment, which is what leads to the development of scar tissue that ultimately becomes collagen formation. Now, it's also thought to be a modulator of angiogenesis. Angiogenesis is the development of new blood vessels. By modulating, that means it can either increase it when you need more blood flow to an area or decrease it in particular reasons. And that can be potentially good to help healing as well. It also stimulates nitric oxide production. That's a vasodilator, so you get more blood to a particular area, delivering more oxygen. Some people think that because it does that, it may actually be good for endurance. And it's very anti-inflammatory. It downregulates what's called TNF-alpha, a very pro-inflammatory cytokine. Now, let's talk about it specifically as it pertains to knee pain and using it not so much as an injection you give yourself or as a capsule, a pill that you take every day, which is how most people take it. But we're talking about now injecting it directly into the knee, the same way orthopedic surgeons do cortisone injections or hyaluronic acid injections. There was a study done at the University of Central Florida. It was published in the journal Alternative Therapies last year, 2021. And I'm going to tell you on the front end, as we go through this, I think this study has major issues. But it is potentially interesting in terms of the conclusion that it reaches, and I'll explain that as we go. Now, this is a study, it's retrospective, meaning they started at a particular point in time, looked back at all the people that doctor had injected BPC into the knees. Sometimes it was just BPC, sometimes it was BPC plus thymosin beta 4, another peptide I've talked about on my YouTube channel before. That's a peptide that comes from the thymus gland. Also one that's got regenerative properties, wound healing properties, might be good for nerve injuries, pain, that type of thing. So again, some people got just BPC injected in their knee, some people got BPC and TB4, and we'll talk about how that breaks down. But that's the argument of why the physician added the BPC or the TB4 to the BPC, is it can help reduce inflammation and reduce pain. Now, this was done, the practice is the Institute of Hormonal Balance in Orlando, Florida, looking at injecting BPC either with or without TB4 to see if it relieved knee pain. Again, retrospective studies. So there's issues with retrospective studies in terms of you didn't get their pain score right when they came in the door. You're asking them now a year later, things like that. The length of time that they followed up varied. Sometimes they were contacted 6 months after the injection, sometimes a year after the injection. One of the patients in the study, there were 17 that got the injected BPC, 16 were reached for follow-up in a phone survey. In that phone survey, again, they were asked to rate their pain prior to the injection, which is really difficult 6 months or 12 months later, but they were asked to do it. They were asked the length of time that the peptides actually helped the pain and how much that pain relief existed. Now, there were no IKDC scores or all the WOMAC scores, all the different knee rating scales that are used, and you see abundantly in the sports medicine literature. They didn't do any of that here, but the doctor that did this, in his defense, is not an orthopedic surgeon. So there were no functional assessment tools or anything like that. The goal was to determine, whether or not BPC 157 injected into the knee, whatever the cause of knee pain was, actually relieved their pain. And again, some of the people, I think only 4 had an MRI, so we don't know how many of these were arthritis, how many of these were a meniscus tear, combination of that, ligament injury, something like that. So we're just talking about knee pain, but could be from a variety of causes. So they gave 4 milligrams of BPC 157 injected into the knee, and then there was a dose of TB4 given in some of those patients as well. Of the 16, remember there were 16 total injections available for follow-up, 12 got BPC only, 4 got the combination. In the group that only got BPC injected into their knee, according to this study and this physician, 11 out of the 12, when contacted later, said they had significant improvement in their knee pain. That's 91.6%. Almost 92%, where only 1 had no improvement. Again, the 4 patients had a combination of BPC and TB4, and there 75% had significant improvement. 3 did, 1 different. So overall, that's 14 out of 16, 87.5% had relief of their knee pain when they had BPC injected into their knee, whether or not TB4 was also added. Now, I want to get to what this means and what that physician concluded. Small study, very admitted that, says that BPC helps with multiple types of knee pain when it's injected into the knee. Now, there's a lot that needs to be done with this. I told you the issue with retrospective studies. It'd be great if he or somebody started at 0.0, you have a placebo group definitely, and you randomize the people into different groups. You know exactly what their MRIs look like, what their diagnosis is, so you only treat one type of knee or one cause of knee problem, whether that's osteoarthritis or degenerative meniscus tear. Well, that usually coexists, but traumatic meniscus tear, things like that. You would want to know that. Potentially follow-up MRIs. You'd want pain scales at from the before treatment to during, or the day after to weeks later, to see the benefit. The other thing that this study doesn't do, and he openly shows this, is that we don't know why the people got better. There was no follow-up MRI studies to see if the cartilage was thicker, no knee scope going in and looking at the knee. So we have no idea if it healed anything, if it rebuilt cartilage, anything like that. But what we do know is that it decreased pain. And so that's where I think that this is really interesting, because I have, based on the scientific literature I've seen, I have no idea if BPC rebuilds cartilage, if it helps, let's say, a torn ACL inside the knee heal. May have some benefits, we just don't know, and that's going to need a lot more study. But I will say, both from this paper, and I've heard this physician talk on a podcast about this study, it does seem to be very good for relieving pain. And that's what I'm hearing talking to other people that use it as well, as added as an injection into the knee, it does relieve knee pain. I've talked a lot about the problems with cortisone shots. Cortisone weakens tendons and ligaments. It speeds up the degradation and the degeneration of cartilage, potentially speeding up the arthritis. I am not a big fan personally of intra-articular steroids like cortisone shots. The BPC 157, may be a much safer way to get pain relief, especially a short-term pain relief or more of an acute pain relief, without the downsides of cortisone. The other potentially interesting avenue as far as this goes would be potentially adding it to something like platelet-rich plasma, or platelet-rich plasma with alpha-2 microglobulin, I can't talk, or exosomes, stem cells. Those types of treatments work well, but they take time to have their effects, months and months in a lot of cases. Added to that, BPC may give them some pain relief early while the stem cells or the PRP or the exosomes do their thing to hopefully build or promote cartilage regeneration and repair, decrease inflammation of the joint lining, remodel subchondral bone, things like that. I think it's very exciting. It's just that this study, in his defense, it's a retrospective study based on what he has seen in the practice. And again, he's not an orthopedic surgeon either, which makes getting routine MRIs, routine x-rays, having those functional scales really difficult. On the podcast, he actually offered, hey, if there's any orthopedic surgeons that want to do this study with me, a better version of this, he'd welcome it. I actually thought about responding, but I am so far removed from the research world. I'm still a reviewer for several journals, but I'm sort of past the wanting to do research myself anymore. So I never did do that. But having said that, it is an interesting idea. Why it helps, we don't really know, but does seem to be very, very beneficial. So Angela says, if I can get this on the screen, I can't. I don't know why I can't show your comment, Angela. Let me, there we go. Just Google BPC 157, pricey. How long would you need to take? Never heard of this. That sounds good. And then it's 9:11 a.m. in Melbourne. Very cool to have you from Australia. And now I can't get it off the screen. So BPC is, and it's one of there's two sides to that. Again, as I said at the very beginning, very, very, I don't know Australia, and if it's something approved by your medical boards and regulatory agencies in Australia. In the United States, the FDA still considers it experimental. And that's why so many people go online to get it online. And it's cheaper that way than getting it from doctors and pharmacy or doctors' practices who get it from FDA-approved compounding pharmacies that make it. That's the way I would strongly recommend people here in the United States do it, and not do it on BPC, or not do it online, try to get BPC. If you read Tony Robbins' new book, Life Force, he has a whole chapter on peptides. Talks about how great they are. Quotes a study, or quotes somebody, I can't remember who it exactly was, said that 80% of peptides sold online are complete fakes or frauds. Plus, they aren't scrutinized, those pharmacies, by the FDA, and so you don't know what you're getting. There may be harmful fillers and contaminants. It's just not, in my opinion, safe or a good use of your money. If you get it from a physician, it is going to be more expensive. There's no question, and I don't know that I can tell you exactly what that's going to be. That depends for a lot of different factors. As far as into the knee for knee pain, it would just be a one-time treatment, or maybe you do it once a week for 3 weeks, or once a month for 3 months into the knee. If you're taking it to heal an injury, muscle, tendon, ligament, something like that, there is some differing opinions on how long you take it. Do you take it orally, or do you take it as an injection that you give under your skin? The studies, most of the studies for musculoskeletal injuries talk about it as an injectable form. That would probably be, if I was going to recommend it to somebody, maybe how I would do it, but there are oral forms of BPC. Probably better for GI issues than musculoskeletal issues. But there, I've seen anywhere for 20 straight days for an acute injury, up to just using it daily for 3 months if it's just overall soreness and things like that. So there is a lot of differing opinions. If you have any other questions, feel free to leave those real quick while that's going on. I will say tomorrow, and Alicia, that your question fits into this perfectly. I do other orthopedic questions in an Ask Dr. Geier segment once a week, or Ask Dr. Geier show, live 12 p.m. Eastern time. I do it until all the questions are done, so feel free to join us tomorrow. Anybody that has a question about a particular injury, surgery, recovery, rehab, join us for that. It's still not medical advice, but I will give you my opinion. Then you can take that to your doctor and say, hey, what about this? But I am not giving you medical advice. If you would like to come see me as sorry about that. If you'd like to come see me as a patient, I see patients in Charleston, South Carolina. It's a beautiful place. You'd love it. I've got somebody coming from out of the country in a week and a half, something like that. So it's definitely something. I mean, a third of my patients travel into Charleston to see me. So I am happy to do that. One of the few triple board certified orthopedic surgeons that is certified by the American Board of Anti-Aging and Regenerative Medicine. I say that not because of the board certification, but because I can talk to you about all kinds of treatments, not just cortisone, not just physical therapy, not just surgery. The information to that is in the description below this video, the link to my website, drdavidgeier.com. Go to that page, click on the contact form, fill that out. My assistant and I can help set that up. Very, very, very excited to have you here today with us. Again, join us tomorrow. for Ask Dr. Geier Live. Remember to subscribe to the podcast, Better Than Ever Live, wherever you get your podcasts. If you can't be here live on Thursday afternoons, thank you so much. Very, very excited to have you, and I will see you again very soon. Take care.